Hey, my name is Christy Joy Ras, and I'm from the Knowledge Translation Unit. In this short video, I'm going to orientate you to some of our resources that will help you as managers to ensure you and your staff are up to date with the latest COVID-19 guidance and practicing safely. The third edition of the PAC COVID-19 guidance was released on the 21st of May, and it is available for download on our website. This guidance has been communicated via Circular H89 of 2020, which is an update to Circular H84. This circular lists all the guidelines and documents that have been referenced in the content. The sections that we believe will be most useful to you as managers are the expanded Practice Safely section and how to manage the health worker exposed to a person under investigation for COVID-19. In this presentation, I will also show you the online learning course that is available alongside this guidance, as well as share some mental health care resources you can refer staff to. Featured here are the pages that cover how to practice safely. Improvements and updates from the last version have been highlighted in red with the explanation. As managers, you have the difficult task of rearranging the systems in the facilities. Guidance is given to staff on this page under number 5 on how to manage the patient flow. Infection control is addressed with practical suggestions aligned to best practice. What PPE to wear and when to wear it is clearly outlined, as well as when to change PPE. These pages recap the correct way to put on and take off PPE. It is really important for all your staff to know how to remove PPE correctly. It is a good idea to get them to practice this. There are instructions for you to give your staff around transitioning or moving between home and work safely. There is a lot of anxiety around transmission to families, especially vulnerable members at home, and this information can bring clarity and ease of mind to your team. Lastly, safe travel and suggestions of how to care for mental health are featured. As a manager, so much is expected of you. These pages are divided up into sections that you can use systematically to address your staff to ensure they practice safely. As you are aware, there is much anxiety about health worker exposure. Managing this is challenging. The flow diagrams on these pages reflect the content of Circular H77, but set it out in a step-by-step manner to walk you and your staff through assessing the type of contact they may have had and what level of exposure risk they fall into. Use this page to determine the risk level of exposure to a person under investigation for COVID-19 and the appropriate management. And use this page to determine the risk level of exposure to a person with confirmed COVID-19 and appropriate management. This clear and simple approach to this sensitive topic is designed to make the management of these serious situations as supported and objective as possible. As managers, it is also useful to know that there is an online course for health workers that orientates them to the PAC COVID-19 guidance. It is found under the Resources tab on the KTU website. Seen on the screen here is that tab. The course uses an interactive, case-based approach to the guidance, where the users engage with the PAC COVID-19 guidance in the form of quizzes that work them through a case. There are 3 cases in this edition. The first one is a patient who presents with symptoms suggestive of COVID-19 and needs non-urgent attention. The second one is of a health worker who's exposed to a colleague who becomes symptomatic for COVID-19 and how to manage the situation. The third case is also of a health worker who is struggling with occupational stress. Information on how to assess, manage, and mitigate risk of exposure is covered in this case to help minimize the occupational stress. Users need to create an online learning account, and the course is set up to be data-free. They then start working through the case, which should take approximately 2 to 3 hours, which can be done in different sessions. The features and benefits of this online learning option include that it is accessible from a laptop, tablet, or phone. The course is data-free. It can be done individually or in small groups who are practicing social distancing. It has 3 CPD points allocated to it, which are given on completion of a quiz requiring at least a 70% pass at the end. Reporting to the Department of Health or the City of Cape Town has been built into the course. Staff completing this course and using this PAC COVID-19 guidance will be able to provide standardized care and together improve systems in the facilities. We acknowledge the impact of this pandemic on the mental health of all on the front lines. As managers, you are not only responsible for caring for your own mental health, but also need to ensure adequate capacity in your staff to function and keep functioning. Here are some available on-demand counseling resources that you can refer your staff to for support and help to manage the anxiety and fear in this time. I will quickly introduce you to two apps that are free to use to access mental health support. Vula is an app that assists primary healthcare workers to send referrals directly to medical specialists. In response to COVID-19, the app has recently launched a national health worker mental health support hotline that allows frontline workers to reach out to a qualified psychiatrist, psychologist, or registered counselor. Using Vula, health workers are able to receive 2 or more free mental health support and counseling sessions. There are currently 3 different practices from which to choose from on Vula. This presentation will be available on our website for you to access this information. This is how to reach out to a professional on Vula. Download and open the app, select New Referral, select Health Worker Mental Health Support, select the on-call practice you would like to contact, complete the form and add any preferences or concerns you might have. Your chosen practice will reach out to you using the Vula chat to arrange a time for your session. Another useful app resource is EM Guidance or Essential Medicine Guidance that provides access to a range of guidelines and resources. It has developed a tab for mental health support with links to helpful tools. We hope that these resources presented here empower you with options to offer your staff and in so doing lighten the load you have as managers. Thank you for the work that you are doing. We truly appreciate it. All the best and stay safe.